So students, today we do the two very important joints of lower limb, the hip joint and the knee joint. So studying these joints without knowing their movements is meaningless. So we start with the hip joint. Hip joint is a synovial joint of ball and socket variety. And as with all synovial joints like the shoulder joint, it allows a considerable amount of movement. So there's a socket here which is formed by the acetabulum in which the head of femur it articulates. So that is the hip joint. Now I'll demonstrate the movements at hip joint. So I told you, like the shoulder, a lot of movements are possible at the hip joint: flexion, extension, abduction, adduction, medial rotation, lateral rotation, and circumduction. So let me demonstrate the movements at the hip joint. So one needs to stand in the anatomical position with the arms by the side. And for performing the flexion, what we need to do is we need to keep the knee extended. So the knees are to be extended. So stand in the anatomical position and bring the foot forwards like this. So this is flexion of hip joint. And this, when I'm standing now in the normal position, coming from the flex position, this movement back to the normal position is extended position of hip joint. So normal standing position, anatomical position, the hip is extended. Even this movement, when I go back, here again, the hip is extended. So flexion, extension, and even this is extension. Then abduction at hip joint will be like this. Remember to keep the knee extended. And this is adduction, bringing the limb back to its normal position. This movement is adduction. Once again, abduction, adduction. Then for medial rotation, keep the knee extended, and this movement is medial rotation at hip joint, while this movement is lateral rotation at hip joint. So when we bring the foot inwards, this movement is now medial rotation at hip joint, the knee is extended, while this movement is the lateral rotation at hip joint. So these are the movements possible at hip joint. Now I shared the screen. So hip joint is studied under various categories. And one is the type of joint. So then we do the various ligaments of the joint, and out of them, the main ligament is the capsule of the hip joint. Remember students, capsule attachment on the femur, it is attached anteriorly to the intertrochanteric line and posteriorly to the crest, 1 centimeter medial to the crest. Okay, so anteriorly attachment is to intertrochanteric line and posteriorly it is 1 centimeter medial to the crest. So the posterior attachment is in relation to the crest. So P and C, PC. Posterior attachment is in relation to the crest, intertrochanteric crest, but it is 1 centimeter medial to it, while the anterior attachment is on the intertrochanteric line. And then one ligament which is very important for the hip joint is the iliofemoral ligament. So the iliofemoral ligament is a Y-shaped ligament. So that ligament, inverted Y-shaped ligament, is attached to the intertrochanteric line. And because of this ligament, the dislocation of hip joint occurs posteriorly. Now we come to the relations of the hip joint. And here you see that the different relations of the hip joint are evident. Anterior relation of the hip joint is the iliopsoas muscle. So this is a strong flexor of the hip joint lying anteriorly. So iliopsoas muscle, it's a flexor of the hip joint. And then again, anterior relation, we have the femoral nerve, which lies in the groove between the iliacus and psoas, femoral artery, and the femoral vein. So femoral vein, it lies on the pectineus muscle, while femoral artery, it lies on tendon of psoas. And this, you have to remember that the iliopsoas muscle is forming the anterior relation of the hip joint. Superior relation of the hip joint, we have the rectus femoris. We can make out this is green line is representing the hip joint. So superior relation is the rectus femoris, gluteus minimus, gluteus medius, and part of gluteus maximus. So when we come to the posterior relations of the hip joint, we come to the gluteus maximus, the largest muscle. Then we have the piriformis muscle. We have the tendon of obturator interni with the two gemella in relation to it. while the inferior relations of the hip joint include the obturator externus muscle and the pectineus muscle. So you must remember this diagram showing the different relations of the hip joint. So now movements of the hip joint, how to remember it? So now iliacus and psoas, they are lying in front of the hip joint. So when they will contract, what they will cause, they will bring the thigh near to the abdomen. So that is flexion of the hip joint. So iliacus and psoas are flexors of the hip joint, and the muscles at the back of the hip joint, like the gluteus maximus and the hamstrings, they are extensors of the hip joint. So always remember, muscles of the front of the hip joint, they will cause flexion, iliacus and psoas, while muscles lying posteriorly, gluteus maximus and hamstrings, they will cause extension of hip joint. Abduction, there is an abductor mechanism at the hip joint, and abductors are the gluteus medius and minimus. And remember that the anterior fibers of the abductors are also medial rotators. So it's always good to remember this way, that abduction is caused by gluteus medius and minimus, and anterior fibers of the abductors, they cause medial rotation along with tensor fascia lata. Adduction is done by all the adductors. So you have adductor longus, spelling mistake here, adductor brevis and adductor magnus. So adduction is performed by adductor longus, brevis and magnus, while abduction is performed by gluteus medius and minimus, and the anterior fibers which of the muscles which cause abduction, that is anterior fibers of gluteus medius and minimus, cause medial rotation along with the tensor fascia lata muscle. Lateral rotation is done by two obturators. So what are the two obturators? Obturator externus and internus. Two gemelli. What are the two gemelli? Gemellus superior and inferior, and the quadratus femoris. So remember, students, these are the muscles performing the different movements at the hip joint. Now we come to the knee joint. Knee joint is the most complicated joint of the human body, and knee joint is between the articular surfaces of the femur and the tibia. Between the condyles of the femur and tibia, you have got two condylar joints and one saddle joint between the femur and the patella. So you have two condylar joints between the condyles of femur above and tibia below, and one saddle joint between the condyle of femur and the patella. So it's a compound synovial joint. Knee joint is a compound synovial joint, and here in this figure we see a sagittal section through the knee joint. So knee joint also has got various ligaments. The cruciate ligament, you can make out the cross here, so that is why they are called the cruciate ligament. You can make out the ligamentum patella here getting inserted onto the tibia. The capsule of the knee joint is there, and there are various other ligaments of the knee joint. One important ligament is the meniscus. So we have got a lateral meniscus and a medial meniscus. Here what we see in this figure is the superior view of upper end of tibia. So here you see there's a lateral meniscus here, and there is a medial meniscus here. And anterior horn of medial meniscus is getting attached here in the intercondylar area of tibia, and posterior horn of medial meniscus is getting attached here in the intercondylar area. For lateral meniscus, anterior horn is getting attached here in the intercondylar area, and the posterior horn of lateral meniscus is getting attached here in the intercondylar area. So in the examinations, it is asked to students arrangement of structures in the intercondylar area of the tibia on the superior aspect of the tibia. So for that, we have a mnemonic: Medical College Lahore, Lahore Medical College. So what does it mean? From anterior to posterior, in the we have the following structures. Anterior horn, because it's the anterior part, so anterior horn of medial meniscus, so medial. Then college, cruciate, so we have anterior cruciate ligament. Then Lahore, again lateral. So M stands for medial, cruciate and lateral. So M stands for medial, college stands for C, cruciate, and lateral stands for Lahore. So Medical College Lahore, since this is the anterior aspect, anterior horn of medial meniscus, anterior cruciate ligament, anterior horn of lateral meniscus. So these are the structures arranged from anterior to posterior side. Now on the posterior aspect, we have got Lahore Medical College. So we have got lateral meniscus, medial meniscus, And from C, we have cruciate ligament. Since this is the posterior aspect, we have posterior horn of lateral meniscus, posterior horn of medial meniscus, and posterior cruciate ligament. So this mnemonics helps you in memorizing and explaining to the teacher your answer. So remember, from anterior to posterior in the intercondylar area, in the anterior part, we have, you remember in your mind, Medical College Lahore. So M stands for medial meniscus, anterior horn of medial meniscus. Then C stands for cruciate ligament. So anterior cruciate ligament. Then L stands for lateral meniscus, anterior horn of lateral meniscus. So it's Medical College Lahore. And then we have Lahore Medical College. L stands for lateral meniscus, posterior horn of lateral meniscus, because now this is the posterior part we are dealing with. Then M stands for medial meniscus, since this is the posterior part. So posterior horn of medial meniscus. And then lastly, college C, posterior cruciate ligament. So students, remember the arrangement of structures in the intercondylar area. To understand this, you see this in the figure, the lateral meniscus is circular. Okay, so that is why its anterior horn is coming here, and it's going like this, and the posterior horn is again coming near the anterior horn. So it's circular, while the medial meniscus is semicircular. So since it's semicircular, its anterior horn is coming in this part, and its posterior horn is coming in this part. So it is not coming near the center. So it is semicircular. The medial meniscus is semicircular, while the lateral meniscus is circular, with the anterior and posterior horns approximated to each other. So these menisci, they are important because they act as shock absorbers. They act as lubricants to the knee joint. So they are important components of the important ligaments of the knee joint. And you have to always remember this. Lateral meniscus is protected by the popliteus. So another way to say this is, even God is partial. God has protected the lateral meniscus but not the medial meniscus, because lateral meniscus, the popliteus muscle is attached to it. It pulls it away and it prevents it from being crushed between the condyles of tibia and femur. So lateral meniscus has got a protection due to its attachment to popliteus muscle. So lateral meniscus is protected by the popliteus, which pulls it backwards so that it is not crushed between the articular surfaces. Medial meniscus, the thing to note about medial meniscus is it is more prone to injury because popliteus muscle is not attached to it, and it doesn't move away. On the other hand, its fixity to tibial collateral ligament and greater movement during rotation, it makes it more prone to damage. So this question is frequently asked in the examination. You know, these sports injuries take place when people are playing football and other sporting activities. So meniscal injuries are common. So which meniscus is more prone to damage? The answer is medial meniscus, because of its fixity to tibial collateral ligament and because of its greater movements during the rotation. While on the other hand, the lateral meniscus is always protected by the popliteus, which pulls it and prevents it from being crushed between the condyles of tibia and femur during extension. So students should always remember this thing. So here one can appreciate how the menisci are dividing the knee joint into the superior, or we can say upper and lower compartments. So this is medial meniscus. Its proximity to tibial collateral ligament needs to be appreciated. These are the superficial and deep parts of the tibial collateral ligament. While this is the lateral meniscus, which is circular, and its relation to the tendon of popliteus needs to be appreciated. So its relation to the tendon of popliteus needs to be appreciated. So you can appreciate it here that this tendon of popliteus is attached to lateral meniscus. So it protects it. Now, movements possible at the knee joint. So flexion is performed by the muscles biceps femoris, semimembranosus, and semitendinosus. So out of these muscles, semimembranosus and semitendinosus also cause the medial rotation. along with popliteus muscle. Extension is performed by quadriceps femoris, while lateral rotation is performed by the muscle which was present here forming flexion. Biceps femoris, it performs lateral rotation. So we have three muscles performing flexion, out of which two muscles they perform medial rotation, and one muscle on the lateral side, the biceps femoris, it performs lateral rotation of flexed leg. So you must appreciate here that the movements at the knee joint are flexion, extension. Extension is done by the quadriceps femoris. Again, the ligamentum patella, that is the insertion in the front of knee joint. So that's of quadriceps femoris. So when it contracts, it extends the knee joint. So extension is done by the muscles attaching on the front through a common tendon, ligamentum patellae. So flexion is done by the back muscles. So biceps femoris, semimembranosus and semitendinosus. So the medial muscles, semimembranosus and tendinosus, along with the popliteus, they cause medial rotation of flexed leg, while lateral rotation of flexed leg is caused by biceps femoris. So there is another important concept regarding the movement of the knee joint, that is locking and unlocking of knee joint. So when we are normally standing with in a tension position, so when the knee is fully extended, we say it is locked. So locking occurs due to medial rotation of femur during the last stage of extension. So locking occurs due to medial rotation of femur during the last stage of extension. So what happens is that the lateral condyle and the medial condyle, their sizes are different. So for proper adaptation on the medial condyle, lateral condyle size is smaller, medial condyle size is bigger. So lateral condyle is used up in extension, but medial condyle, some part of it is still remaining. So what happens is that for better adaptation on the medial aspect, during the last stage of extension, medial rotation of femur takes place on the tibia. And this medial rotation of femur which takes place on the tibia is due to the action of quadriceps femoris muscle, which is called the locking muscle of the knee joint. So during unlocking of knee joint, the femur rotates laterally during initial stage of flexion, because what was done in the last part of extension, that has to be undone. So that is during the early stage of flexion, the popliteus rotates femur laterally on the tibia. And this initial lateral rotation which is done by popliteus muscle, so that is why popliteus muscle is called the unlocking muscle of knee joint. So now I want to show you the movements at the knee joint. So to show the movements at the knee joint, flexion, you keep the hip extended, stand in the anatomical position. So this is flexion at the knee joint, and this is extension at the knee joint, performed by quadriceps femoris. Flexion is by semimembranosus, semitendinosus, and biceps femoris. Now, medial rotation of semiflex leg. So for that, you have to semiflex the leg, and now this is medial rotation of semiflex leg, or I can show you by going a bit backwards. Medial rotation of semiflex leg, and this is lateral rotation of semiflex leg. So when you're standing in the tension position, that is, the knee is locked, and during the early stages of flexion, the knee is unlocked by the popliteus muscle. So these topics are important. Do the ligaments with particular emphasis on the capsule of hip joint, and you also do the iliofemoral ligament of hip joint, and then the names of the other ligaments you should know of the hip joint. And then when you come to the knee joint, give due importance to the menisci and the movements at the hip and the knee joint, and also the arrangement of structures in the intercondylar area of the tibia from anterior to posterior aspect, which menisci is more prone to damage and why, and then what is locking and unlocking of knee joint. So with this, I sign off today's class. The notes are there for this class. Go through these notes, go through this video, compare the notes with the video, and then I think you will be able to understand the anatomical aspects of the hip and knee joint. So till the next time we meet, it's bye from me. Thank you for watching.